Hello, everybody. This is Dr. Jim Vitale, Doctor of Acupuncture from Suffolk County Acupuncture. And I am here today with the sales manager from PowerMedic Lasers, Maja Grinsted Hillegass. He is here today to have a conversation with me in regards to laser therapy, in particular, the GigaLaser that I have been using in my clinic for a little while now. And we're just going to have a conversation about the benefit of laser therapy for fertility and other conditions. And we're just going to go into some of the details on how it works, why it works, and how it can benefit. So, Maja, welcome. Thank you for joining me.
Yeah, thanks for having me.
My pleasure. Thank you. So thank you for taking the time to have this conversation. I know a lot of people out there are curious to keep hearing about, red light therapy, PBM, LLT, all these different terms for laser therapy. And I just wanted to get an expert on to kind of discuss the pros and cons, the benefits, especially how it can potentially help fertility. So that's why you're here today. So thank you for joining me. Let's start right from the beginning. Please tell me more about yourself.
Sure. As you mentioned, my name is Maja. I'm the sales manager at PowerMedic here in the US. I've worked for the company for about 10 years now, but it's actually headquartered in Denmark, which is where I'm from as well. The company was started over there in 1982 by my dad, Arne Grinsted. So he's been making lasers for a long time. I grew up with laser therapy being this go-to remedy. And then we have our US office here in Wisconsin, where I'm located. So that's my background. My dad is by background, by professional, an electronic engineer. And towards the late 70s, early 80s, got really interested in, at that time, very alternative medicine and things like that. And then combined that with his engineering background, started PowerMedic.
So it's in 1984? 82. Wow. That's amazing. 40 plus years in the business. That's fantastic. And it's primarily in Denmark, and then you branched out to the United States?
Yeah, primarily in Denmark, but we sell our lasers around Europe as well, and a few other areas of the world, but mainly Europe and here in the US at this time, at least.
Oh, that's wonderful. It's a family business, so that's nice.
Right.
That's great. Excellent. So I know one of the main things that people are looking to laser therapy for now is fertility. Prior to the recent studies, lasers have been used for what other conditions?
Right. Yeah, great question. In general, laser therapy works really well for a number of different issues. So it can be acute sports injuries like a sprained ankle, or it can be more chronic pain like arthritis pain, or just repetitive strain injuries like tennis elbow or carpal tunnel syndrome, back pain, neck pain, wounds. There's so many different things you can use laser for, and it's very natural and non-invasive. So I don't know if you wanted me to talk a little bit about how laser therapy works and like the mechanisms, or...
We can talk about that now, or if you want to wait for how it applies to the fertility aspect, we can wait for that because we're going to discuss the studies coming up. But for the pain management, could you explain briefly how the mechanism of action works?
Right. So, yeah, I mean, how, in short, laser therapy accelerates the natural healing. So the body's already designed to heal itself, but with laser therapy, you speed up that process. So what the research shows is that when you apply laser light to an area, the mitochondria, the powerhouses of the cell, are able to absorb the laser light and use it to produce more ATP, so more energy for the cells. And then along with that, you're also increasing the blood circulation, reducing pain, regulating inflammation, relaxing muscle tension, enhancing the immune system. So really, in short, helping the body heal itself faster.
Right. That's wonderful. Some similar mechanisms of action to acupuncture, but again, different. The acupuncture works more on, similar actually to blood flow, to opening up the vessels, relaxing the nervous system. But the mitochondrial aspect is really fascinating. And that's what I hope we can get into a little bit more in just a little bit. But that's great. That's great. So I know one of the more recent studies, I know in my study, so I've been using lasers in my practice for quite a few years now. I've tried many different systems over the years. Some good, some not so good, and I know it's all about the power plus I know there's a calculation to determine how much energy is imparted into the body part. We don't have to get into that technical aspect just yet, but there are many different systems out there that I've tried, and again, in varying degrees of success.
Right.
But in my studies, and especially I owe a big debt of gratitude to one of my colleagues and mentors, Lauren
Mhm.
of Acupuncture Wellness Center. He introduced us, and he's been a tremendous educator and proponent of laser therapy. So a big thanks to Lauren out there for introducing this to the world, and especially to the acupuncture world. Well, we can use these in our practices to further enhance our results. But in the studies or the research that has been done, one of the studies came out in 2019. Then you had some research on the clinics in Denmark, how their success. Could you explain that a little bit to me about that, the results of that?
Yeah, and actually, so in 2016, we published the first article summarizing the results that we had seen from 8 clinics in Denmark and Norway at that time. And by then, about 239 women had been treated with GigaLaser. A combination of women, well, they were all having trouble getting pregnant. Some did just the laser treatment, some did them in combination with other types of art or assisted reproductive technology. And from those clinics, we saw a success rate of about 66%, which we thought quite amazing. And then more and more clinics, especially in Denmark and Norway, started to use the GigaLaser for fertility as well. And then in 2019, as you mentioned, we published another article summarizing the results we had seen by then. By then, about 400 women had been treated. And again, the success rate was about 60. Again, these were women ranging from, I believe, was age 34 to 50. That was at least one woman at the age of 50 who became pregnant as well, which is kind of wild. So, I mean, these are all women in common. Some did it in combination with other types of art, and some did just the laser treatments alone. But really great results. And then since then, more and more clinics are adding this on, which is just really cool.
I'd like to pause you there and just comment. When I was doing my research, when I came across that number of 65%, I was at first incredulous. Now, and then in the further research, diving deep into that, I said, wow, that's amazing to have a 65% pregnancy rate. Again, some were naturally conceived with laser, plus I believe the clinics were also doing a form of physiotherapy in conjunction with laser. So it wasn't acupuncture, it was a form of physical therapy, I believe, similar to like the Mayan abdominal massage or some type of abdominal therapy to help blood flow circulation, plus the addition of the GigaLaser. And some others were just going through ART, either an IUI, intrauterine insemination, or IVF. And combination of those two had a combined success rate of approximately 65% pregnancy.
Right.
That's incredible. Now, why that's not on the front page of every doctor's journal saying, do this first, it amazes me that they're not. But again, that's traditional medicine is always slow to pick up the newest studies and the latest and greatest, unfortunately.
Right. But yeah, hopefully we'll get there.
Yeah, well, I think now with the advent of information being able to spread so much more through social media and things like that, I think many of the doctors are starting to catch on and like, wow, okay, there is more that can be done that may be outside of their realm of expertise, but is definitely something a patient who's starting to go down the fertility journey should consider.
Right. Yeah. And like you said, often they'll do it in combination with other things too, perhaps in combination with acupuncture or the physical therapy things. And it seems like it really complements each other.
Absolutely. Great. So that was 2016 through 2019. That's that report that was published. And now I believe there's a new one. So could you tell me more about the new one?
Right. Yeah, so the newest one is based on results from 2022 from a clinic in Copenhagen, Denmark, that's run by Anne Marie Jensen, who's a physical therapist. At least to my knowledge, she has the clinic where they've treated the most women for fertility using the GigaLasers so far. So in 2022, she collected data from some of her patients that she had treated, and really great results. She was able to sort of divide them into, age ranges and who received the GigaLaser treatment in combination with, for example, IVF, and who received just GigaLaser alone. And again, really great results, like especially in the age range, like in the age range 35 to 39, and then from 40 to 44, the results were really good. So it seems like, especially in that age range, it really makes a difference. And that's both whether they, combine it with, for example, IVF, but also, GigaLaser treatments alone. So, for example, for the 35 to 39, I believe the success rate was about 87%, which is amazing. The success rate for those that also received IVF, it was 38%. If compared to the success rate of, I guess, IVF alone is not that great in that age range. Depending on where you are in that age range, is maybe 20 to 32%. It's quite amazing. So again, we saw really good results.
But to clarify, the second group was the 40 to 44.
Right. And for those, it was a little bit of a lower success rate, but still a 57%.
That's
So
much better than IVF alone. And then the 35 to 39 range saw an 87% pregnancy rate.
that's it. Yeah. So,
That really is amazing. So what's happening here in the body? I know you briefly described the mechanism of action of how lasers affect mitochondria, but let's look at that a little deeper. So what do you think is happening? Like, what's causing this increased success?
yeah, and perhaps you can expand on that too, but at least to my knowledge, as women age, the amount of mitochondria or the mitochondrial activity decreases, especially in that area as well. And so I think really in short, because with laser, we're able to increase the amount of mitochondrial activity or mitochondrial health, helps to increase the chances of pregnancy where we otherwise may not have had those chances.
To clarify, if somebody watching doesn't know, mitochondria are the powerhouse, basically the little energy producers of every cell in your body. And the mitochondria produce energy called ATP. Now, the cell needs raw materials, oxygen, it needs O2, it needs carbohydrates, it needs certain amount of nutrients to produce ATP. But then as we age, that ability goes down. So what has been discovered with red light therapy or with laser therapy, that the certain wavelength, and you can attest to this better than I can, certain wavelength around 800 to 840 nanometer range is the most conducive to improving that mitochondrial functions, feeding those mitochondria the batteries, the energy it needs, so it can now produce more energy. Is that a proper way of putting it?
Yep. Yeah,
Okay.
definitely. Yeah, that was great.
And the other thing I recall from high school biology and plus all my other medical training is that the ovaries are one of the most dense areas of mitochondria. So when we were born, when God made us, however you want to look at it, the highest concentrations of mitochondria in the body are the brain, the heart, and the ovary, because those are the three organs that are most important for survival of the human race and propagation of the species. So I think I remember reading and hearing that the ovaries per cell has over 100,000 mitochondria per cell, and the ovaries have approximately 50,000 mitochondria per cell. So that's how important mitochondrial function are to health and particularly for fertility. And it's the hallmark of aging is that your mitochondria produce less and less energy. The cell is less and less functional, and eventually just stops working altogether. So if we can feed the cells the energy it needs to act the way it's supposed to act, in this case, produce a good egg that is then viable for fertilization and then implantation, then we're turning back the clock and we're rejuvenating those cells. Does that sound right?
I think that's a great way to put it. Yeah, for sure. Definitely.
Okay.
And it's interesting because then the problem with those clinics that are using the GigaLaser for fertility, for younger women, it doesn't seem that GigaLaser makes as big of a difference because they already have the mitochondrial function that they need. And so if they're struggling with fertility, there may be other issues that are going on that laser might not really make a difference for. If they're, I don't know, undernutrition, or if they're overtraining, or other things where laser may not be able to make a difference.
So laser therapy isn't a magic bullet for all fertility conditions. Is that correct? So certain conditions, just laser wouldn't be your first modality to go to. But what other conditions, fertility related, would you say it would be beneficial? I know for maybe advanced maternal age or diminished ovarian reserve, those candidates.
Yes, for sure. And yeah, we've also seen great results for women with suffering from endometriosis or irregular menstruation, or where they are not getting their menstruation, and then help, bring that back. In general, it seems that laser just helps the body sort of bring things back to normal, healthy state. So yeah, endometriosis or menstrual pain or scar tissue, sometimes that can be an issue too, and laser can help soften up scar tissue. So yeah.
How about PCOS?
Yes, I have heard good results with that too. I must admit I don't have a lot of details on it, but yes, I have heard.
I've been using it myself for some PCOS patients and see encouraging results.
Okay.
Especially women. Because many times in PCOS, the ovary, they're just not ovulating. They have long cycles. There's just a major imbalance. And I'm seeing that once I get them on the Giga, they start to energize and normalize. Oh, this is very powerful stuff. This is wonderful. So I'd like to show a quick clip. I have a very short video clip just to demonstrate what a GigaLaser session might look like. I believe I'm going to share my screen so everybody can see this. And this is a clip of, I believe it's Anne Marie Jensen in Denmark, doing the GigaLaser while also doing neck manipulation, since she is a physical therapist, right? So let me do this. Okay. So here we have it. There's no sound, but I'm just going to hit play. And basically, as we can see here, the laser is in a very comfortable position. It is just hovering about an inch off of the skin. So it's not making direct contact. It's just hovering. And it's a very comfortable treatment. All you feel is a nice warming sensation throughout the whole abdomen. And here you can see she's just doing a very gentle neck manipulation, neck stretch to further relax the body and adjust her structure. But as you can see, as the laser really is just a very mild sensation, very relaxing. I find it for people who do get it, feel that their body goes into a deep relaxation when they're doing just the Giga. Their body goes into a nice, deep, parasympathetic, relaxed state. Yeah, so here she probably will be on that for about 20 to 23 minutes, most likely. So that's one thing I would like to ask you in a moment is suggested protocols, like how much, how often, where, that kind of thing I'd like to discuss in a moment. I just want to see. Yeah, this was a very short video clip, so I'm going to end that here. So as anybody watching this can see, that the GigaLaser is a very convenient, very relaxing, and there's nothing scary about it. It's actually very relaxing.
Right. And it's non-invasive. It's natural. It's really just helping the body do what it's supposed to do, but in a more optimal way. But yeah, that's a good point. And as shown in the video, you can really cover a large area such as the whole lower abdomen. Like you said, it's very relaxing. As far as the protocol, in general, we have a lot of different protocols depending on what it is you're treating. For fertility specifically, what we recommend is starting on the first day of menstruation, and then do a total of 6 treatments over the 2 weeks leading up to ovulation. So about every other day, if possible. 1 treatment about every other day for those 2 weeks leading up to ovulation. And then when you're expecting ovulation, stop the treatment, try to get pregnant or see if you get pregnant. And then if menstruation returns, start laser treatment again on that first day of menstruation. 1 treatment itself is usually 23 minutes. It's laser therapy combined with LED or light therapy. The laser light is what would deep into the tissue, and as we talked about, stimulate the production of mitochondria and other great things with laser. The red LED doesn't go as deep, but it does help increase the blood circulation just below the surface of the skin. And that's probably the part where you may feel some warmth or relaxation from that. So it's a really nice combination to really, optimize your chances.
So there are two things happening at once. You have laser, which is invisible, and red light that's combined with it. So you see one thing, but there's actually two different wavelengths happening at the same time. And they're working on different levels of the body. The laser, you said, penetrates deeper. So to get down inches inside, so it can reach the whole lower abdominal cavity. But then the red light that we actually see is more superficial. Does that sound correct? Okay. Better than any.
Exactly.
That's the difference. Okay, good. Because I'm sure a lot of people look at that and say, oh, well, I could go on Amazon and buy a red light pad for $90, but that's just a fancy kryptonite. That's really not doing much to penetrate deep. It's maybe get some superficial circulation happening, but it's going to get to the mitochondria, the cells that we need to affect.
Exactly.
That's how it is. Yeah, I could say personally, I've been using LEDs and lasers in my practice for at least 5 years or more, and with varying degrees of success. Most of the lasers I've used in the past were handheld lasers, where it was a spot laser that covered maybe this much of surface area here, and I'd put it right over the abdomen and wait a minute and move it, and about 10 minutes worth of therapy on as much surface area as I could cover, and I saw moderate success. It wasn't always great. I did get some results, but not a ton of great results. But I've since been using the GigaLaser now in my practice since October, and it's really been a game changer. It's really been wonderful. I've been seeing so much more success with it because it's 23 minutes of that, and it really is far and above the most powerful laser I've ever seen and used. And my concern was, is it too powerful? And that's what a lot of patients, oh no, is it gonna fry my ovaries? Is there any chance of any negative side effects that might occur?
No, I mean, with laser therapy in general, there are no known side effects. The only two contraindications, situations where we recommend not using laser therapy is pregnancy. So once you're pregnant, we recommend not treating with laser therapy just in case. It may not do any harm, but, just to be safe. And then cancer as well. And again, with those two, there's just not a lot of research yet to show whether or not laser would be harmful. So just to be safe, we recommend not treating those two instances. But other than that, laser is really safe. And yeah, again, no known side effects. If you are treating over an area where there is a tattoo, we do recommend perhaps covering that tattoo with like white tape or something like that, because otherwise that dark color in the tattoo could sort of absorb all the energy instead of it going deep into the tissue where we want it to go. And that can create maybe perhaps a bit of an uncomfortable amount of warmth in that area.
Right. The color in the ink absorbs the heat.
Right.
You feel like a hot sensation. Okay.
Exactly. But yeah, other than that, it's perfectly safe. And I mean, our protocols are based on, a few different factors. Of course, our own experience throughout the past 40 plus years in the business, and partly on our customers' experience, and partly on recommendations from WALT, the World Association for Photobiomodulation. They're an organization that's been around for a long time that promotes laser therapy and research. So our protocols are based on, I think, some pretty good activities.
It sounds like there's a lot of research behind it. And I think also because the class of laser makes a difference. This is a class 3B.
Yeah, correct.
And so my understanding is that a class 3B is non-ionizing, meaning it doesn't give off a significant amount of heat. So we're not warming the area. There are medical lasers that are class 4. And 4 laser has the potential to burn, has the potential to do damage. Is that correct? Am I...
Right. Yeah. Class 4 laser. So it depends, or what makes a class 3 or a class 4 laser is the output power per diode. So all the little things on the GigaLaser screen are laser diodes, and depending on the power per diode that will then make it either a class 3B or a class 4 laser. And so a class 4 laser is a higher power per diode. And yes, with some class 4 lasers, you often have to keep it sort of moving around the area in order to not heat up or damage the tissue, where with a class 3B, you can safely hold it still and treat an area over, 23 minutes, for example, without heating up or damaging the tissue.
So that should calm people's fears of potentially doing any damage. That we shouldn't do any damage at all. That's great. Excellent. I mean, it sounds wonderful. I know I'm very happy. My patients are very happy with it. I've been using it. So one thing I did want to come back to, actually, you mentioned with those studies, or at least the time frame. I know it's 6 sessions starting from day 1 of the period up until ovulation. So as many as you can get in, ideally 6. Then take a break. If the period comes, do again over the course of 3 months. Is that about?
Right. Yeah, I would say, I mean, often when we do see positive results with the GigaLaser for fertility, it often happens in those first 3 to 6 months after starting treatments.
Right.
Yeah.
And I can explain why I think that happened is because it does take 90 days to improve egg quality, because the follicles that are the dominant follicles that are coming out now were predetermined to come out 6 months ago. Actually, the last 90 days when those follicles really start to mature. So whatever we do to your ovaries now, those follicles that are predetermined to be the dominant follicle in 3 months are the ones that get the most benefit of the mitochondria. So if we can treat for 3 months, that's why oftentimes I'll tell a new fertility patient, like, give me 3 months. And if you don't do this, 3 months is going to go by like that, and you'll still be in the IVF cycle without getting any benefits. So 3 months is not a long time, but it's not an instant improvement either, because it takes at least 90 days to improve egg quality. It takes 90 days to improve sperm quality for a male factor. So it does take a little bit of time. So yeah, that's where I'm seeing the benefits too, where 3 months of consistent use between the laser and Acu. Plus, we also do herbs, we do fertility massage, nutritional supplements. We throw all this into the mix. And at the end of that 90 days, then we start to see significant improvements in quality of cycle, quality of the period, and just balance of hormones. At that point, sometimes they need more than that. It's a minimum. But at that point is where things really start to take a turn for the positive. So I think that's why the 3-month rule is an important thing to acknowledge, because it's not an instant gratification, one session and you're pregnant. No, it was that easy that we can just do one session and send them on their way. But that's not how healing works.
Right.
Healing from anything takes stages. It takes time. And so as long as we give the body the raw materials to heal itself, it will heal over the course of time. So 3 months of consistent sessions is an expectation that everybody should have to rebuild health. In the grand scheme of things, 3 months is not long. That's not long.
No, good point.
So great. This has been one. Any last comments, statements?
I don't know. I mean, we hope to spread the word around this and hope to get more clinics off of this, because it just really seems to help a lot of women. And I guess we hope to be able to help even more women in this journey. So
it's the interesting fact that in the United States, there's not many clinics offering the GigaLaser.
Right.
I think as of now, I'm the only one in the entire state of New York that's offering the GigaLasers. I mean, I think every clinic in the world should be wanting one of these to really beneficial. It is that powerful. So I'll help you spread the word, because I'm a believer. I love the Giga and I'm a huge fan.
That's awesome. Well, and I really appreciate your time with this too. I'm really glad to hear that you're getting really good results. Yeah.
Very exciting. Well, Maja, thank you so much. I really appreciate you being here today and having this conversation regarding this wonderful topic. And hopefully let's see more improvements. Let's see more laser babies hit the world here. I appreciate it.
Thank you.
Have a great day. And everybody else who's been watching this, I hope you enjoyed this. I hope you learned a thing or two about how laser therapy can potentially help not only fertility, but overall health, and how it is something that should be considered.